Today's presentation will be on the ethical issue of benefiting or potentially harming your patient. Ethics is about values, views, and experiences and is the basis of how we should act and what we should do in order to provide people with the best life possible. Public health ethics deal with the specific moral questions regarding public actions for disease prevention, life elongation, or psychological and physical well-being. This is in contrast to medical ethics, which concentrates on the relationship between patients and doctors. Nurses can face a wide range of ethical issues in their everyday practice. As you can see from the table provided, protecting patients' rights, autonomy and informed consent to treatment, unethical practices of health professionals, and several decision-making issues are among the top ethical issues that nurses face on a daily basis. The data in this table was drawn from the results of 422 questionnaires completed by nurses across 4 different states. Nearly 64% of these nurses said that they face the ethical issue of protecting patients' rights on a daily basis. Just over 61% of them said they face the issue of autonomy and informed consent to treatment on a daily basis, and 41% said that advanced care planning was a frequent or daily occurrence, and there were more even responses in regards to the decision-making ethical issues, such as surrogate decision-making and end-of-life decision-making. This range of data relates to the case study on the Ashley treatment that I will be presenting to you today. The foundation of ethics in nursing is being aware of the ethical issues that may occur in healthcare situations. Nurses must be able to recognize and analyze ethical dilemmas and must adhere to the code of ethics set by the nursing board. In specific situations, nurses may need to solve the issue using their instinct or gut feeling. Majority of decisions made on a daily basis are made using these natural human reactions. However, when it comes to far more serious life or death situations, nurses must use more than just instincts to solve the issue. Common sense does not always provide the best solution, so nurses must seek advice from a physician, another work colleague, another nurse for example, or even the patient themselves, because sometimes a nurse may act on instinct, but that decision is opposed by others involved. In these more serious matters, nurses will need to refer to their code of ethics and other parts of the framework. Nurses must value the legal and moral right of people, including children, to participate whenever possible in decision-making concerning their nursing and healthcare treatment, and assist them to determine their care on the basis of informed decision-making. The Code of Ethics is not a concrete set of meticulous rules that must be followed in every situation. It is more of a guideline that highlights values that need protecting. The Nursing Code of Ethics is intended to direct rather than protect. These codes do not provide walls within which it is safe to act. They are made to stimulate thinking, thus assisting nurses or healthcare professionals to act instinctually and confidently for themselves, using the code as a guide. This case study is about a 6-year-old girl named Ashley who suffers from a developmental brain condition called static encephalopathy. Ashley had what is considered to be a normal birth, however she has since failed to develop mentally and physically. This condition leaves her unable to do simple tasks such as walk, talk, sit up, eat, or even roll over on her own, as you would expect from a girl of this age. According to her doctors, Ashley has not grown past the developmental age of a 3-month-old baby. Ashley was admitted into Seattle's Children's Hospital for a surgery now referred to as the Ashley treatment, which involves a hysterectomy, the removal of her uterus, in order to prevent menstrual discomfort, the removal of her breast buds to stunt growth of her breasts, and giving her a high dose of estrogen to stunt her growth overall. This is a somewhat controversial therapy in medicine, as are most experimental therapies or procedures that have not been proven. Ashley's parents claim that the treatment was solely to benefit their daughter in order to give her a better quality of life and to reduce the inconvenience of her caregivers. In these types of cases, the parents are usually required to make decisions that protect or promote the interests of the child, and doctors should only offer treatments that are in the child's best interests. It is morally and ethically wrong to suggest a treatment that is against the interest of the child but in the parents' or others' interests. The questions that it raises in medical ethics are: were these treatments in Ashley's best interests? Do they treat her as a person with dignity and respect, and were they likely to make her life better? We also need to consider disability rights, which would claim that this treatment could have possibly led to the violation of human rights for the disabled, especially since Ashley was not suffering and the treatment was untested. Deinhardt and Gleason, ethicists from Seattle University, asked the following questions. Are there uses of medical technology that are inconsistent with a dignified life? Could this decision lead us to endorse even more controversial procedures? Could we use the other procedures to reduce the size or reproductive capacity of a severely demented adult patient at risk of receiving substandard care because of his or her size or vulnerability. And finally, if the treatment became standard medical practice, how will it affect insurance coverage or rates? As with all practices in medicine, there are consequences following the experimental procedure, such as future patients inquiring about the treatment. There is a case where another 6-year-old named Jenny shared the same conditions as Ashley. Her parents asked the nurse, Miss Ballinger, if she would suggest this treatment for their daughter, as they trusted her and respected her professional opinion. Miss Ballinger was one of the nurses assigned to Ashley during her treatment, thus having direct involvement and experience. However, she had heard all the commotion that it had caused in the media and in the medical world. She was unsure whether or not this treatment would be beneficial or harmful to Jenny. While she sympathised with the parents and Jenny, she was not sure that this was a good medical intervention to improve Jenny's quality of life, and she was aware that her colleagues and the paediatricians involved were conflicted on this issue. She was also aware, though, that Jenny's parents valued her opinion and recognised the influence she could possibly have on the decision-making. Although Miss Ballinger knew that there were questions about family and societal benefits, her primary concern was whether the treatment would be beneficial for Jenny. Now, this case is a prime example of the ethical issues that arise in terms of benefits and harm to a patient. Miss Ballinger is put in the position where she could seriously influence the outcome of this child's life. When Jenny and her parents need the opinion of the nurse, she finds it challenging to respond definitively and decisively. In the past, Miss Ballinger could have responded by saying, "Ask your doctor." However, the doctor may not necessarily have any expertise or experience with this treatment, thus leaving the parents' questions unanswered. In this day and age, nurses are able and willing to share their opinions openly with patients and surrogates, and if they are unable to provide a straight answer, they must discuss the situation with colleagues. In some cases, parents or surrogates do not ask the questions, and nurses are still obligated to question interventions that they do not believe are of benefit to the patient. This is the power and responsibility that nurses carry today. In this case, Miss Ballinger told Jenny's parents that she had not yet made up her mind about the Ashley treatment, but asked them if they would like to be part of the conversation she has with her colleagues who were familiar with the Ashley treatment and Jenny's condition. The parents agreed, and Miss Ballinger began a review of the literature. She was careful to find articles that represented the diversity of opinions about the Ashley treatment. When the parents, Miss Ballinger, and her colleagues met, medical experts presented the medical facts of Jenny's condition, and a local ethicist led an ethical analysis. An article by Clark and Vasta proved persuasive, which concluded, "It is clear that the Ashley treatment does not minimize the risks incurred by this patient, but exposes her to unnecessary risks that have the potential for injury, harm, and even death. This is an experimental, non-life-saving treatment with serious and even deadly unknowns. Arguably, this treatment not only fails the test of beneficence, but it also fails the test of non-maleficence." Jenny's parents decided not to request the Ashley treatment. Miss Ballinger believed that she was helpful to them in making their decision and with living with its consequences. In modern-day healthcare, it is expected that nurses and other healthcare professionals protect their patients from harm and do whatever they can to benefit them. In trying to figure out how to benefit one's patient and protect them from harm, the following 4 separate problems arise. 1. How does the nurse determine what counts as a benefit when there is uncertainty or differences of opinion among patient, family, and/or other members of the professional caregiving team? 2. Should the nurse strive to produce the greatest possible general benefit for the patient, or should the nurse focus only on health benefits? 3. Should the nurse give special weight to protecting the patient from harm, or do benefits and harms get the same weight in calculating net benefits? And 4. Should the nurse try to do what is most beneficial in each individual case, or should the nurse think in broader terms, say by acting on a set of rules that will produce more good on balance than any other set of rules? In order to resolve these situations, management must first have faith in their staff, knowing that they have the knowledge and intuition needed to benefit their patients rather than harm them. If they are unsure, we must have faith and trust that they will seek advice from their colleagues or do the research required on specific situations. It is, however, up to management to ensure nurses are adhering to the Code of Ethics at all times. Thus, I suggest we conduct monthly meetings reviewing cases within our organisation and referring to the Code of Ethics to ensure that all staff members, including nurses, physicians, and other healthcare professionals, are equipped with the know-how going forward. These situations will arise in our field as we gathered from the data provided in Table 1. In summary, ethics is the basis of how we should act and what we should do. Ethical issues such as protecting patients' rights, autonomy and informed consent, unethical practices and decision-making are common occurrences in the healthcare field and occur in the case study of the Ashley treatment. The Ashley treatment refers to the experimental and controversial treatment of static encephalopathy. The ethics of this treatment were questioned in the study, and were questioned by the parents of Jenny, who sought advice from their nurse. The nurse was unsure on whether or not the treatment would benefit Jenny, so she conducted research and organised a meeting with her team and the parents to come up with a solution. In modern-day healthcare, nurses are expected to protect their patients from harm and do whatever they can to benefit them. In order to keep this expectation to a high standard of quality practice, we will be conducting monthly meetings to discuss any cases or situations nurses may have faced or may face in the future, referring to the Code of Ethics and reaching a solution together. It will be a place where all members of staff can express their feelings and share ideas with colleagues, and in order to benefit our patients at every opportunity.